We're now going to go over a nurse-only type of visit and a combination care gap visit. So a nurse-only, or sometimes we'll refer to these as asynchronous visits, means that the nurse is going to go to the patient's home, but they're performing care gaps that don't require the APP to be involved while the nurse is there. And so the APP role is simply to go back into these notes while they're on shift after the nurse has already gone and just do a quick review and make sure that all the information is there and the orders are signed. So we're going to choose this note, which has a depression screening, a kidney health evaluation, and a hypertensive screening. So you'll get used to over time which care gaps are nurse only and which care gaps will provide, or which care gaps require an APP. So this patient is already checked in, but I'm just going to jump ahead a few days, and you could see that normally the visit will actually tell you nurse only. And so you'll be able to see that you're not required for that visit, and all you'll have to do is just quickly go in after and verify the information. So let's click on this visit. All right, so now we're in the exam view that we've been using for all of our different care gaps so far. And this part will be a little bit different because since you, the provider, are not involved, the nurse is already going to be putting in the reason for visit. And so when you go into the chart, these will already be selected based off of the care gaps that need to be complete, which you'll be able to see on the schedule page. And the orders, we're looking at our snapshot of the assessment and plan section, are already here and have already been completed by the nurse. They just need to be signed by you. So I'll just quickly go over these three care gaps because you're going to see these on a very regular basis for these nurse-only visits. A depression screening simply means that the nurse is going to do a PHQ-9. Remember that depression screening, PHQ-9s, we only do for annual wellness visits, TCM visits, and depression screening care gaps like this. Our kidney health evaluation is for patients who are already diagnosed with diabetes, and they need to have periodic monitoring of their kidney function to make sure that everything is okay. And so this is really straightforward. When the reason for visit is entered by the nurse, it already populates everything that's required, including the lab orders and the urine that's going to be taken. So all you have to do for this type of evaluation is simply sign the order. The rest of it is taken care of. And your hypertension screening is just doing a blood pressure check. Of course, the nurse is going to take the vitals and, just make sure that it's within a reasonable limit. The only time we'll take action on a blood pressure is if it is, abnormally high to the point where we may need to refer to the emergency room, or the patient is having, symptoms with the high blood pressure, and we'd have to refer to the emergency room. So remember, I'm not actually going to do it now, but if you want to know more information about these, you can go to the gap closure protocol document and go to the section for each of these. And you can also do your little cheat and go to the assessment and plan section and take a look at exactly what's in each section to know what needs to be completed. So these combination type of visits where you're seeing multiple care gaps are very, very common. So even though thus far we've been going over a care gap one by one, it's not uncommon for you to have to do multiple at once. It doesn't sound as hard as you think because a lot of the care gaps overlap with each other in terms of always having to do the intake section, always having to check the vitals. You're always going to perform an HPI. You'll always do that quick physical exam. So it tends to be pretty fast, even though there'll be multiple on there. And you may have visits where there'll be one care gap that requires an APP, and there'll be additional care gaps that are nurse only. And so when you get on, you'll just have to perform the care gap that requires the APP, and the nurse only ones will already be completed, and all you have to do is review and sign the orders. So to start with our review, we're just going to look through our side panel what we call our intake section to make sure that everything is okay. We'll check the allergies. And so like I've said in previous videos, I want to emphasize where I'm moving my mouse here, it says the word reviewed. If you do not go into these sections and review the information, this will stay as the word review instead. And so when the full encounter summary is done and printed, our clients will be able to tell that a provider never went into that section and reviewed the information. So very important that you go in there. Of course, you're not going to be speaking to the patient during this because it's after the nurse is already gone. So you're just reviewing it based off of the available information you have. So an allergy has been noted. We want to make sure that our problem list matches the med list as best we can. So you'll notice here that the patient has medication of metformin and amlodipine listed, but they only have a diagnosis of type 2 diabetes in their problem section. So it looks like this was missed by the nurse while they were having their visit. I've mentioned this in other videos. Again, this problem and medication section is going to be where you'll find the most gaps in information from when the nurse is doing it on their own to when you jump on. So of course you can't ask the patient, further follow-up questions. But if it's medications that lead to an obvious diagnosis, such as amlodipine for hypertension, then you're okay to add that to the problem section. And so since they're on amlodipine, but they don't have hypertension listed as a diagnosis, I'm going to add that now with my plus button. All right. I'm going to choose a hypertensive disorder. And remember, you're always going to get rid of that date. We never want it on there. I'm going to add it, and now it's on our problem list. All right, so we verified them. We looked at the meds and the problems. Our vaccine section, none was entered for this patient. Perhaps they haven't had any vaccines. If they are, you could add them with the plus or the note section. The vitals, this was just a test patient, so I didn't enter every single vital, but I did put in a blood pressure because this is a hypertensive screening. So you will see that when you go into that note. So you'll see all the vitals there, and the PHQ-9 is completed as well. So you can see that the blood pressure was well controlled for this patient. That's the hypertensive screening. And the PHQ-9, which covers our depression screening, had a score of 0. So nothing additional to do there. We're going to jump to the history section, and you can see that the social history, including the substance use, those 4 questions, and the PCP questions that you've seen now over and over again in these various videos, are all completed, and those have to be done for every single visit, regardless of what we're doing. So we've done that section. We could already see that our reason for visits are put in by the nurse, and so this part is completed. So we were going to skip ahead to the HPI section, and because you didn't see the patient, there really isn't much of an HPI to write here. And so we just will write something to the effect of what I wrote here. I just pre-populated this, but this won't show up on its own. So let's just pretend we're going back to the review section. We've checked those things. We're going to the HPI. This area will be blank, and we're just adding a quick note to say that they were seen by one of our nurses for these screening visits, and that's enough for you to put, and you can move to the next section. Obviously, there's no ROS. Physical exam, we didn't see the patient, so there'll be nothing there as well. And then we'll go to the assessment and plan section. So you can see that we have our diagnosis for depression screening. The screening for disorder is the kidney health evaluation, and then we have the hypertensive disorder. So let's go through these quickly because this will be part of your review. So the depression screening, you'll see that it has this text and then the same box that you would click on and have options that we've now seen on multiple types of care gaps that we've gone over. So for the depression screening, when you click on this box, it provides you with the different options you could choose from based off of what the patient's score is. So you can see these different options based off of mild to moderate, severe, or a patient with a severe score, or someone who presents as a danger to themselves or others. In this particular case, the score was 0. So we're going to choose a minimal to none score. No further action is needed. And so that's everything you need to do for the depression screening, except make sure that you go through these education materials. So remember, we've covered these before. Anytime there's education material, we always do a quick discussion with the patient, and we want to make sure we click that discuss with patient box. Discuss with patient box. So that covers the depression screening. You quickly reviewed it, you move on. Our screening for disorder, this is going to have just some general information for why we do this kidney health evaluation for patients that have a diagnosis of diabetes. None of this needs to be changed. There's no options to choose. This care gap is essentially just running labs and taking urine for the patient. So you can see that the lab orders are already entered. Quest Diagnostics is already there. There's literally nothing to do here but sign the orders when you're ready to move to the next page. So this area is the kidney health evaluation is very quick, very simple to do. And when the orders come back, they'll be in the lab inbox, and that's the point where we'll actually call the patient and discuss the results with them. If there's anything abnormal, we would forward that to their PCP. For how to interpret the results of this screening, you would use the gap closure protocol, which will tell you exactly what you would need to do based off of what the results are. And then our hypertensive disorder, we check their blood pressure. You can see in the text box that there is this clickable box again that we've seen so many times now. And it just gives you a quick option of well-controlled or not well-controlled. So their blood pressure was 112/80, so it was well controlled. And we also typed the blood pressure into this section. So patient's blood pressure is well controlled at 112/80. So we always type this in. When you see this originally, it will be blank and we'll say insert BP here. And so you just delete that and you will type in the blood pressure that the patient had. And now you have everything you need. We're telling you to continue to follow up with their PCP for treatment. If for whatever reason the blood pressure was higher, or I'll explain that in a second. So we'll move on from that. So that covers that section. And just like with above, we have these educational pieces. We just want to quickly click discuss with patient, discuss with patient, discuss with patient, discuss with patient, and our last one, learning about high blood pressure, discuss with patient. You just want to make sure that all of those are checked. So that is everything you need to review. You can see that this video is fairly short and it would be much quicker in real time when you're just going in and taking a look at this to make sure that all the information is there. The last thing I'll say is that for these type of screenings, the depression screening, for instance, or the hypertensive screening, the only time the APP would become involved is when the nurse is there and a score is abnormal. So if the patient has a PHQ-9 score of over 10, it would be escalated to an APP, and then you would then join the visit and just do some assess the patient clinically and decide what would be most appropriate. It may still be referring them back to their PCP, but of course you want to assess to make sure that the patient is not a danger to themselves, which is really our goal. We are not performing, full mental health visits. We just want to evaluate to make sure they're safe, and if they are, quickly get them to a mental health professional or their PCP. And for a hypertensive disorder, same thing. If the blood pressure is really high, the patient is 180 systolic, they'll call an APP, and so it will be elevated to you. You can get on and evaluate, is this number fairly regular for the patient? Are you having any symptoms? Assess clinically if you think that it can be managed with the patient still at home, or if you need to refer to the emergency department. I'm not giving a full, breakdown of your available clinical options. You can use your best clinical judgment. I'm just giving a few examples. So once you're done with that, you'll click sign orders. I won't do it now because I don't want these orders to go to Quest for this fake patient, but that will sign everything and the orders will go to the lab. You'll click the next button, which brings you to sign off, which as always will show you that quick summary of the visit. And if everything looks okay, you'll hit the close button in the corner, and that will close the visit and bring you back to the schedule page so you can see your next patient. So you will see these type of nurse-only visits on a regular basis, where all you'll have to do is just do a quick review and make sure that everything looks okay. You won't actually be talking to the patient themselves.